Another protocol we are deploying in the fight against the spread of COVID-19 on our campus is the quarantine, isolation, and contact tracing protocol. First, let's examine the difference between quarantine and isolation. According to the CDC, quarantine is used to keep someone who might have been exposed to the COVID-19 virus away from others. Quarantine will help prevent the spread of the COVID-19 virus before a person knows they are sick or before they are infected with the virus without feeling symptoms. This is referred to as asymptomatic. On the campus of Livingstone College, individuals who have been exposed to the COVID-19 virus will be asked to first quarantine. We have designated quarantine rooms at the School of Hospitality Management and Culinary Arts on the Jake Alexander Boulevard. Students in quarantine should separate themselves from others, monitor their health, and follow directions from their state and/or local health departments. Once a student or a member of our campus community is screened and verified to have come in close contact with a person infected with the COVID-19 virus, even if they feel healthy, must quarantine for a period of 14 days and do so based on their last exposure. Employees will quarantine at home, and students will quarantine, as I mentioned earlier, at a private room in the School of Hospitality Management. Students will use technology to complete all academic assignments, and 3 meals a day plus snacks will be provided by our food service partners. Isolation, on the other hand, will be used to separate people infected with the virus. Infected is defined as those individuals who are sick and diagnosed with the COVID-19 virus. Please note, students who are asymptomatic but test positive for COVID-19 will follow the aforementioned quarantine protocol. However, individuals who have symptoms and are positive for COVID-19 will be isolated from people who are not infected. People who are in isolation should remain in isolation until they are cleared by the medical director or the RN of the Student Health Center. According to most testing protocols, individuals must have 2 consecutive tests with a negative result in order to be cleared and removed from the isolation protocol. Under this protocol, anyone sick or infected with COVID-19 will be housed in private rooms at the Robinson Health Center on the campus of Livingstone College and will be monitored by our campus medical team. The isolation protocol will also be deployed when individuals have been diagnosed with COVID-19 or awaiting test results, particularly if they have a cough, fever, shortness of breath, or other related symptoms. Students in isolation will use technology related to academic instruction if they are well enough to do so. 3 meals a day will also be provided for them by our food service partners, and a special diet may be required based upon the severity and symptoms related to this COVID-19 virus. Finally, contact tracing is used to identify individuals who have come in close contact with someone who is infected with the virus. This is used to break the chain of transmission. By this process, contacts of individuals are screened, tested, and if deemed necessary, are quarantined or isolated. The Rowan County Health Department will execute contact tracing on behalf of Livingstone College in the unfortunate event a student or on our campus tests positive. Also, we are deploying a special mobile app in an effort to automate this process. This app will enable us to execute contact tracing by utilizing technology. For more information based on this protocol, please visit our website at www.livingstone.edu. Thank you.